Predictive analysis is the use of electronic algorithms to help us predict future events in real time. These algorithms are integral to machine learning. Specifically in the healthcare industry, machine learning is creating a tool practitioners can use to diagnose patients quickly and make cost-efficient decisions. Using these algorithms allows practitioners to potentially make more diagnoses and have higher detection rates. Because predictive analysis learns from the new data it receives, the diagnosis will theoretically get better over time. This can be beneficial because of the high populations in emergency rooms and hospitals in general. Doctors are already pressed for time in between patients. Using machine learning as a guide for diagnosis can help the process become more efficient as a whole. The article itself brings up the split responsibility that doctors can experience between helping their individualized patients and following the solutions provided to them by predictive analysis tools. The issue is that some of these softwares and predictive analysis tools are made to improve the overall health of the population or reduce healthcare costs, but an individual patient may not fit into the framework of the overall population. At the end of the day, if we could diagnose ourselves from external resources that are generic, like WebMD, we wouldn't be spending our money going to the doctor in the first place. But every individual is unique. In my opinion, it's important for physicians and practitioners to cater a patient's care to that specific patient rather than heavily rely on the resources provided that can predict a patient's diagnosis or treatment. The balance starts when we begin to train our doctors. The same way that we're taught to do math by hand, even though a calculator on our phones can do all of the calculations for us, it's important that residents understand the basis of a major diagnosis and understand their area of specialty to the same degree that current physicians do. While tech is being produced to make the system more efficient, we run the risk that it'll depersonalize the system. If the system becomes depersonalized, we run the risk that patients will be dissatisfied by the hospital service and care provided. As a hospital, it's important for us to cater to our patients and assure them that they are receiving the best care. The risk is that patients will feel even more sidelined or undermined than they currently do. If the system becomes so cost-efficient that doctors spend the minimum time needed with the patients, there is a high likelihood that the patients won't be able to discuss their options fully with their doctor, and this could lead to decisions that aren't safe or smart for a particular patient. At the end of the day, we need to make sure that a doctor's role doesn't overlap with that of the hospital's administration.
Young's research can be seen as a small subset of Alfandra's article, as Alfandra focused on the predictive analysis portion of big data. We see an example of it being used in Young's research. His question was, can internet searches for opioid use, specifically Google searches for opioid use, be used to track and predict the future heroin-related health issues? While this isn't necessarily used in a clinical setting or with clinical data, Young's research delved into if the data that can be collected by the general populace could be analyzed into some sort of predictive format. His study was conducted in 9 different metropolitan statistical areas in the US, and it obtained its data through Google searches for prescription and non-prescription opioid use. He also looked over the Substance Abuse and Mental Health Services Administration data on heroin-related emergency visits from 2004 to 2011. This data was then compiled into a linear mixed model in order to analyze the relationship between opioid-related internet searches and heroin-related visits in the next year. Young concluded that this method of collecting and analyzing data should be further explored since it seems to give some predictive correlation for future years and is a low-cost, real-time data source.
The study and the article both discuss how large data can be used to predict future and improve public health. Internet, especially social media, can be considered as a huge database where people post useful information that can be used to track health outcomes. And predictive analytics applications help clinicians to make important decisions with data gathered using electronic algorithms. I think these predictive analytics techniques based on big data can be very useful because it's cost-effective and improve access to care for public health. I found one example that used predictive analytics to improve public health. According to How Cities Are Using Analytics to Improve Public Health, published by the Harvard Business Review, the Chicago Department of Public Health partnered with the Department of Innovation and Technology to engage with local partners and identify various data related to food establishments and their locations, including building code violations, social media reports, sourcing of food, and more. Using this data, they built models that calculated a score that represents risk of critical public health violations. This method helped them to better identify higher risk establishments and prioritize their efforts accordingly using data-based scores. Like this example, predictive analytics can be used in various areas of public health.
Using machine learning to analyze low-cost real-time data to predict public health events is an optimal and innovative strategy. However, there are some problems with this strategy. This strategy fails to account for the systematic oppression that has been built in today's society. Historically, those coming from lower socioeconomic status are more prone to drug use, meaning that they are less likely to have access to resources that we consider standard today. Without the availability of certain resources, like the internet, it is likely that a large amount of opioid users won't use search engines to get more information on the drugs they are using, meaning that a huge portion of the population of opioid users is missing. Using this machine learning approach seems only to be optimal for populations coming from middle to high socioeconomic standing, making this data skewed.